In our previous visits at the Silverstien Institute, we've spoken with Dr. Rosenberg, Dr. Wazen, Dr. Bonneau, everyone here but the man whose name is on the building, Dr. Herbert Silverstien. We're pleased that he's been able to join us right now and talk about some important issues involving your hearing, folks. And I'm going to start off by welcoming you, Dr. Silverstien, to the program. We're glad you could take some time out to do this. So let's get right into this and start with how a person knows or should know when they need to have their hearing checked.
Well, before I do that, I just want to say today to the audience that nobody has to be deaf today. We have technology that's fantastic today, where we can take somebody that's totally deaf and do surgery on them and put a cochlear implant in and let them hear. People that have severe hearing losses, we have special types of hearing devices that are partially implantable that can be put under the skin and can't be seen. And there are other devices that can allow people to hear that are almost invisible. So with that, I think I'll go answer the question, which is how do people know that they're having a loss of hearing? Well, actually the hearing loss comes on usually very gradually. If it comes on suddenly, then they need to see a doctor immediately. But if it comes on gradually, many times they don't realize that they're having a hearing loss, and it's the family that's complaining. And the most common thing in our practice is for the spouse to bring the other spouse in and say, he or she's not hearing me. And of course the spouse that's sitting there in the chair says, I hear fine. And that person doesn't really realize when the hearing is going down slowly that they are having a hearing loss. What happens is sometimes they'll be turning the TV up. Family will notice that. They'll be complaining that people are mumbling, that the kids don't speak loud enough. At any rate, they say, what did you say? What did you say? And so when it's becoming a problem, many times it's the family or in the early stages that bring the person in to have the hearing checked.
Now, in these circumstances, and I believe that probably all of us have experienced this at one time or another, this what'd you say, or turn the TV up, or I can't hear, and so on. I know that you've been a pioneer in the field of correcting the hearing problems for many, many years. But what's different about the types of hearing devices that are available today as opposed to the past?
Well, they're fantastic today. In the past, we had what we called we had hearing aids that were not digital. They were analog. And all they could do was to increase the sound level in your ear. And the patient would hear a lot of background noise, and many times the hearing aids would wind up in the drawer. And actually hearing aids had such a bad stigma that people say, you know, don't try them because they really don't work that well. But today it's entirely different. The hearing aids are, most of them are invisible. You can't even see the hearing aids. And you can't even see the hearing aids. And they're actually miniature computers that can be programmed to the person's hearing loss.
Really?
And what they do actually is they cut out the background noise so the person can hear in noisy situations like restaurants. And the fact that most of them now have an open fit where you can't see them and there's no mold in the ear. It's just an open, very nicely fitting. You can't even know that the person has the hearing aid in there.
So these things, they're customized now.
Customized for each person, and you can't see them now. Do you see that I'm wearing a hearing aid?
No, actually I don't.
Okay.
Are you really?
I have one, a dummy in right now, and I'm sure you can't really see it too well, but I'll show it to you. Here it is. So this is a little device that's actually fantastic. It just fits in the ear very easily. And this allows patients to hear in a restaurant, hear in a noisy party. You know, many times as the person's hearing goes down, they become withdrawn. They don't want to go to the restaurants. They don't want to go into the parties, and they live an isolated life.
They don't believe they can participate. Let's, in the short amount of time we have left, Dr. Silverstien, people don't need to live with this hearing loss problem any longer. You sort of mentioned that in your opening comments.
Right.
And you've got the technology here
Right.
to deal with this. And it's amazing thing that you can customize this to each individual
Right.
so that their hearing difficulties don't exist
Right.
anymore.
That's exactly right. So, you know, we have surgical procedures that we can do. Many times we can restore the hearing surgically with various reconstructive procedures. Sometimes if it's a nerve loss, you know, we can give one of the things that I mentioned
Right.
before, a cochlear implant or a partially implantable hearing aid or one of these devices. But nobody has to be living in silence anymore.
And that's the key message, folks. No one has to live in silence anymore, and Dr. Herbert Silverstien of the Silverstien Institute right here in Sarasota can take very good care of your problems and fit you with the type of device you need, give you all the advice you need, and we'll go on from there. Dr. Silverstien, we thank you very much for your time, sir.
Okay, thank you.
Thank you.